Welcome to The Buzz, where we bring you leaders in dental education, discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Sandy Baird. Now, Sandy has earned a master's in business administration, and she also has over 35 years hands-on dental practice management experience. Whether it's in the office or from the platform, her goals are to reduce practice stress, risk, and inefficiencies. I've asked Sandy here today to talk with us about her course entitled HIPAA in the Dental Office. To tell or not to tell, that is our question. Great title, by the way, Sandy, and welcome to The Buzz.
Thank you, Vanessa. It's a pleasure to be here.
Let's get started. So since we're talking about HIPAA, now I know as a patient that HIPAA's been around for some time. I'm assuming that most dental teams are pretty up to date and current in their practices around all of the HIPAA requirements. Has that been what you found?
I have really been surprised to find HIPAA has not been around as long as OSHA. OSHA has been around since the 1980s. And HIPAA has been more of a 21st century movement in dentistry. And so I find that the requirements for HIPAA really are unknown by a large number of dental practices, and they're surprised. And actually, I was surprised before I started studying and investigating and researching the HIPAA, how much is required. In our practice, I ran my husband's practice for over 30 years, and of course it was my duty. I was the HIPAA officer, I was the OSHA officer, and this is how I initially got started in this. So I had to do a lot of this for our practice, and when I put it all together to present it to teams, it really is remarkable how much more there is than most dental offices are aware of. I think usually most dental offices just think that the practice's privacy policies that they give to the patient kind of takes care of it, but it doesn't. You have to have lists of all your hardware, all their serial numbers, all their make, their model. You have to have list of all the people who have access to your PHI. You have to have various lists like this. So I try to approach it like an inspector is coming into your practice. Like somebody, a patient perhaps, has contacted the Health and Human Resources in Washington, D.C. through the internet that we all are taught through our privacy practices, and made a complaint. And an investigator has come into the practice, and I talk about what they will ask for, what you need to have, what kind of format it has to be in. I also try to turn it into a team activity. I really like to give the OSHA and HIPAA together, because in the OSHA, it seems like the clinical team portion, they're kind of more tuned into the OSHA. And in the afternoon, when I do the HIPAA, I find that the business department of the dental practice is more in tune with that. So it's a real powerful team building exercise, because everybody goes home feeling like they have expertise, and they learn more. They learn what's required, but they also learn the nuances of HIPAA, like what happens if a patient contacts you by email and wants to talk about information concerning his protected health information. How do you handle that? Because email is not secure. In HIPAA's mind, your normal email is not secure. So there are so many examples of that I like to cover. So I find that teams really pick up a lot of information in this course.
And you touched on a couple of things there. It made me think, I know I've heard that fines are pretty steep.
Whoa.
And it's so important that for the dental practice to be sure that they are in compliance. And I recall when you talked with me about your OSHA course, that you mentioned you had team building activities built in. Is that the case here as well?
It's the case here as well. I do a similar activity, but it's a little different. But yes, I think you hit on a really important point. The fines, like if your server is breached and your PHI is breached, you have 60 days to notify all of your patients that their information has been breached. And if you don't, the fine is per patient not breached. And there is a cap of like $1.2 million on it. So no worries, you won't be fined more than $1.2 million. I mean, it really can add up very quickly. And a lot of people don't even know they're supposed to do that. So it's very, and most dental offices I go in, the password for the computer is right there on the computer. So anybody who breaks into the practice or breaches, gets access to that computer, it's right there, and they can just get into the computer and start hacking away. So yeah, there's a lot to learn there.
Yeah, really good, important points. Things that we know, but that all of us have probably some more lackadaisical habits around passwords now than we know that we should. So a very important topic to cover. And so we've talked about it being a team would be ideal, but also if there's a HIPAA officer, that would be a target attendee. We talked about it being great for maybe half-day format.
Yes, it would be great for half day.
And how nice it is to be able to marry that with OSHA as well for those who would like a full day, to be able to have both of those checked.
Knock both of those out, check those off your list.
Yeah, and bring the whole team to have that day.
It's a great day.
And it sounds pretty interactive. Keep it light and fun even while we're learning really important things and really having a meaty course, but cover it in a way that's fun. And is there anything else that would be important for the meeting planner to know around this topic before we sign off for today? Or do you feel like we pretty much covered it?
I think we have, Vanessa. I can't think of anything else that would be vital. I think you've touched on it all.
Well, thank you so much, Sandy, for sharing your knowledge around this and helping us understand more about what's covered in your HIPAA course. Appreciate you being here.
Oh, my pleasure, Vanessa.
And for the event planner who would like more information on Sandy Baird's course, HIPAA in the Dental Office, to tell or not to tell, that is our question. You can find her course description as well as information on her other courses at dentalspeakersbureau.com. Please feel free to email us, info@dentalspeakersbureau.com. We'd be happy to connect you. You can also find Sandy's contact information there, so you can feel free to reach out to her directly. So thanks again for tuning into this episode of The Buzz. And until next time, take good care and be well.